Hello to our friends in Thailand. My name is Philip Rulo with Rultract, and I wanted to quickly go over the options that would allow the surgeon to continue to use the Rultract in the way that they are currently setting it up. Now with the new offset post, it's understood that the retractor is further away from the bed rail, further away from the patient, and the surgeon is having a hard time reaching the incision with the retractor that they're using. Now, I did mention the cable is longer. I'm not sure that that's going to be an answer. So I do have a couple other options. Now, first of all, I must say that the retractor was designed to be used to be set up like this. And in that case, of course, the surgeon would not have a difficult time reaching the incision for the most part. But the idea here is to provide options to allow the surgeon to continue to use the retractor the way that they want to. So the first option is going to be a stirrup holder. The stirrup holder would be used with a Rultract straight spline tip bottom post. Now this bottom post was designed for a different procedure. It does have a collar on it. However, if you put the post all the way down to the collar, of course it's going to be too short. So if you were to put the post about 12 centimeters from the base of the stirrup holder to the collar, you're going to equal the same height as the current system. Now the first time that the retractor is used, obviously they're going to have to figure out the ideal height. After it's used a couple of times, it's easy to set up. Of course, it could also be marked. So if we're going to go somewhere around 12 centimeters here and then tighten it down, you would just take your top post and put it into place. You can see I'm a little bit high here, but of course that can be adjusted if you just hold the post and drop it a little bit and retighten it. Make sure that's tight. So here we are sitting 5 centimeters from the rail. So we're actually closer to the patient than what the current system that the hospital is using is. This is 8 centimeters from the rail. The limitation with this post is if you have a larger patient, it could impede on the patient's anatomy. That's why this was here. Nowadays, patients are larger, mattress pads are higher, and the patient's shoulder is actually hitting the return part, at least in the US, North American market. The patient's anatomy can hit the return part of this clamp. That's why we redesigned the clamp to not have a return. So the offset's not quite as much as here, but there is no return. And that's the problem that your surgeon is having, is we don't have a return on that top post or on the bottom post. Actually, even the new top post is straight. So this would be an option to bring the retractor closer to the table, allow for the correct height, but of course it does have its limitations. Option 2 would be to use a Rultract clamp. This clamp can be set up with the tightening knob on the top or a tightening knob on the bottom, depending on OR protocol. And I'm not quite sure if they would put this on prior to the patient coming in the room like a stirrup holder, or if they would put it on the rail at the same time that they would put the Rultract clamp here on the rail. So what you could do is you can actually put these two pieces together. I'm sure you're going to be able to see this. There is a flat surface right there on this post. That flat surface faces out. So as I put this together with the flat surface facing out, I lower it down to where it's about 12 centimeters collar to clamp, and then I tighten it. And I tighten it real tight, because I'll tell you, if you don't tighten it real tight and you're going to put this on to the bed rail and it falls off, first of all, it's no longer sterile. Second, it hurts when it hits your foot. It's pretty heavy. So try to get it around 12 centimeters, tighten it down, check for tightness before putting it on the rail to save your foot. Of course, you can't do what I'm doing, but check and make sure that it's tight. And then put it on the rail the same way that they put this clamp on the rail. and then just tighten it down. Put your top post on the same way the surgeon's currently putting the top post on. Wouldn't be that difficult if I was on the correct side of the post. So if I were to put the top post on, it goes on very easily. Now you can see here that this sits a ½ centimeter further away from the table. So this is 8.5. Current is 8 centimeters from the rail. So it sits a little farther from the rail. Right now I have it sitting a little bit lower as well. If it's too low, it can be adjusted by turning the knob, raising it to the desired height, tightening the knob. Now if you want it to be lower, of course, you could go significantly lower or you can go significantly higher. It just depends on where you would like to have it positioned. So if you have a very small patient, you can go very low. If you have a very large patient, we can go pretty high as well. And then just make sure that it's as tight as you can tighten it, and then it is securely in place. So that is the other option. So we have a stirrup holder, you have a Rultract clamp, both using the straight bottom post. I hope that information was useful. Obviously contact me with questions. Thank you for taking the time to watch the video. Have a nice day.